Today we are going to discuss about the coping skills, Indian perspective on coping. Now we are going to discuss about the coping. What is coping? See, coping is the ability to push through whatever the person is going. Like, see, most of the time, people what they do is suppose something they are going through. Yesterday's session we discussed about the emotional awareness types of coping skills. Okay. So here, suppose if they're uh, unable to sleep, if they're skipping the meal, if they're neglecting their friends, like social isolation, we call it as. Okay. Even outdoor activities, not meeting people, not going anywhere, not talking, and social responsibilities, they're not doing anything. Okay. These are the lacking of the people. So they don't do these things whenever people are suffering with mental health issues. So here, if the people are they are unable to do all these things, we need to give a helping hand. How we can help the people? We can help the people based on their strengths and the determination. See, suppose someone wants to pass the exam, they want to complete their education, PG or whatever. Okay, so here we need to help the person to complete the education. So we need to remember the strengths of the person, how the person is able to do. Okay, we need to remember the person. These are your abilities, these are your skills. By doing this, you can overcome the situation, you can do more. So here we need to, what exactly we are trying to do with the person in the form of coping skill, we are improving the skill of a person, skill of the person. So here we need to see that how best we can do, how we can improve the person. So here, when we are doing all these things, we need to see how best we are helping, and we need to see the person's ability, how he is doing, where he is lacking. Okay. Suppose one person joined in medical. Right now he is facing some challenges. That's the reason he is unable to do his works. So here we need to help the person. What is the best way to overcome the situation? Okay, once you started helping the person, you will understand. Okay, these are the things you are lacking. This is the dream you have. So try to cooperate yourself and overcome the situation. So here in this situation, what we are doing, we are helping the person with his abilities. So here we are working upon his skills. So we need to look into that. Understood? So we are empowering the person. See, whenever we are dealing with the people, don't go with the sympathy. Show some empathy. This is a when the person is working as a health professional or into the health kind of a thing, mental health professional. First, they need to understand empathy, not sympathy. Whenever you are showing sympathy, people they don't like you. You need to work with the grace and compassion towards the next person. Understand? So these are the behavioral strategies we need to inculcate in our profession. Okay, see, what are the coping skills in Indian prospect? Okay, first thing we will take care of all these things. We'll help the person to have 3 meals in a day, and if he's missing the sleep, we'll make sure that he needs to have at least time to hit the bed. And yeah, we can help the person to go for the indoor and outdoor activities. All these things we can take care. At the same time, we need to understand the person's perspective here. Okay, in what way he is, in how he is helping himself. Okay, what are the best thing we can do? Okay, this is Indian prospect. See, suppose if the foreign prospect, what they do means, yeah, they may take the person for a hangout, see a random girl at, going for a dates and all. But Indian perspective, suppose if the person is not having 3 meals, we will understand there is a disturbance in his health profile. So we will focus on that. Now, and even in the prospective, Indian prospective, people most of the time they will focus on the health prospect. At the same time, they will think mm, yoga, meditation, okay, and the spirituality. Suppose if the person is speaking more, he's having, people will take them to a temple, or church or masjid, and they will do the activities, spiritual activities. See, these are all comes under spiritual activities in every walk of the life of the country. So they may go with the good practices of these things also. Now we need to measure the coping. How we can measure the coping skills? Okay, coping. See, suppose if you are helping the person to change his behavior and to overcome his challenges. Suppose if the person is not overcoming the stressor, okay, whatever the influencing factors or personality traits or environmental demands, okay, if he is unable to do this, here we need to change the coping styles. Okay, why means these coping skills are not working. So here, whatever the strategies we are copying and we are adapting, we need to have a look over those things and we need to change the situational things. Whatever the situation is demanding, whatever the coping strategy we plan, we need to understand, we need to see the dynamics of the response to specific stressful situation. So here, now we'll discuss about the categories depends on the measuring of copings. First one is dispositional coping as a trait. The second one is situational coping as a trait. See, dispositional coping as a trait is fixed one. Okay, here we'll have the merits and limitations. It measures the merits and limitations. What are the merits the person is going with that? Whatever the limitations we have. See, whenever we are talking about the limitations, we need to look into the prospect of what is the approach and what is the individual consistency way of the dealing with the stress. Okay, we need to valid. Then only we can fix the things. Whatever the situation is demanding, how the person is doing, and we need to see in between what's happening, the coping measures and the individual. Okay, this dynamics is completely fixed. Here we can't do any changes. Actually, these are the tailor-made coping styles, we can call it as. Okay, these are the tailor-made coping skills. Okay, overview of the measuring. Try coping measures. Here, cope inventory. Actually, this one is done by Carver in 1989. And the second one is coping inventory for situational stress. Okay, these are the overview of the measures. See, we said we will go with the measurements of the fixed one. So disposition coping state is completely fixed. So these are the parameters we will see. Coping measures. Next one is coping inventory for stressful events, situations or events. Okay, this one is done by Mr. Endler Parker, 1990 and 1994. They have done the study. And the third one is Main's coping inventory. Okay, this one is done by Crohin, 1993. Next one is Miller behavioral style coping. Okay, style scale. This one is done by Mr. Miller, 1987. And state coping measures, base of coping questionnaire. And actually, even in this, we have two methods. One is base of coping questionnaire, and the other one is coping inventory. This one is done by Carvel, and ways of coping questionnaire is done by Folkman and Lazarus in 1988. First, we will discuss about the what is this scope inventory. Okay, scope inventory, it measures whatever the dispositional tendencies adapted to the particular coping style. Okay, so here this one is completely coping orientation to problem experience. Okay, this one is done by developed by Mr. Carver. Okay, it's completely individual differences in coping. Actually, it focus on personality, characteristics, and the predisposed individuals towards the particular way of the coping stress, how the person is reacting towards the stress. So all these dimensions we will see in this coping inventory. Actually, in this scope inventory scale, it contains 60 items. It measures 15 subscales with 4 items with each participant record and score. Okay. So here, this is the main two components are problem focused coping and emotional focused coping. Okay, these are the things it measures. In problem focused coping, what are the things it's seeing? Active coping, planning, and suppression of competing activities, and restraint coping, and seeking of instrumental social support. Okay, these are the five things we'll measure on problem focused. See, that means the scale contains all these things. Now we will see emotional focused coping. See, that's the reason we said it is a tailor made. Okay. In this emotional focus, we'll focus on the seeking of emotional social support. See, what is seeking emotional social support? Suppose if the person is joined in a, suppose if the person is into addiction. So if he joined in a social group of de-addiction, okay, de-addiction center, or joining in a group therapy, all these things comes here. Social support, or he is taking a professional support, all that. Okay, next positive interpretation, acceptance, denial. See, why emotion focused denial is very important. See, if any mental health challenges, if someone is facing, they will say, I don't have this issue. They don't agree with our things. They will see, you are only saying, okay, I am good. I'm not, I don't have any kind of challenges here. So these are the things most of the time people will say it. So here we need to understand those things. Okay, why this person is behaving? What are the things? Okay, denial. When the person is denial, also suppose in co-inventory, if the person is denial, if he's not expecting, yes, we need to see. Next, turning to religion. Okay, see, few people they will completely get into the spirituality. That is the depends on their coping scale, coping mechanism. Even in your family members, you can see something goes wrong. The mother will start doing the pujas, fasting, and they will do homas and all other things. It depends on the person to person. So here, this scale, coping inventory, even look into this aspect. Now, it also contains five scales aimed to measuring coping responses. How the person is responded towards the coping mechanism. So here, what are the five elements we can see? First is focus on venting of emotions. See, few people they will suppress their emotions. Few people they don't suppress their emotions. They will vent out. They will start sharing, or else they will get into the aggressive mode, or else they may get into the passive mode. So all these things we can check by using the scale. Actually, by using the scale, and these are the five scales. Okay, it also five scales aimed to measuring coping responses. The second one is behavioral disengagement. See, suppose behavioral disengagement. We discussed about the social interactions. This is a behavioral disengagement. If the person is avoiding people, not maintaining contact, not maintaining eye contact, not joining in the group discussion, not joining any kind of what you call discussion in the family, avoiding family members, all these things also behavioral disengagement. Next, mental disengagement. The person is not reacting. If he gets angry, not no reaction. If he's smiling, if he wants to be happy, no reaction. So all these things comes under here. Mental disengagement. Alcohol disengagement. See, if you people, oh my God, I lost this. I lost my job. Or else he is in depression. Or else he will say addiction. He will get into alcohol. Okay, so they'll completely engage themselves. See, this world is giving me a lot of pain. I can't take this pain. Let me go ahead. Let me have some one peg, two peg, three pegs. This is giving me a lot of happiness. So they will get into that mode. So this is called lot of this alcohol disengagement. Yeah, humor. Few people they will get into humor. I know one person when I am taking therapy, after the session or before the session, when he is interacting with the caregiver, he will make lot of jokes. Nowadays, become like a habit to the person. For a small reason, also he is joking. Why means that is his mechanism, coping mechanism. He was into bedridden and many things are there, many challenges he is facing. But the person will think whenever he is making jokes, he will think, I am doing conversation. Actually, that is sarcasm. Sometimes they do, but they don't understand. So suppose for no reason people are making jokes and sarcasm with others and making lot of humor. For no reason, they're laughing and they're going with the different jokes. So here we need to understand in that is also one coping mechanism. Here we need to understand the person's perspective, why he is doing, in what way. It is helping to the person. Okay. Next, we'll discuss about the scoring. Okay, right? It's a 4 point scale. So 0, 1, 2, 3, 4. Sorry, 1, 2, 3, 4. 1, 2, 3, 4 means I usually don't do this at all. I usually do this a little bit. 3 means I really do this medium amount. 4 means I usually do this a lot. So those are the four elements in the scoring. So yeah, the maximum score is like ranging from 0.6 to 280. Actually, the scoping inventory was normed by 978 undergraduate students they have done. And yeah, the Cronbach is also, it's a good score, 0.62. So we can use this scale. You can see, you can download from the net whenever you want to. Yeah, you can see. But before conducting on somebody, you need to have the how to do scoring and what are the questions you are asking. You need to have full command over the subject. Then only you can apply the psychometric test on someone else. Okay. For your knowledge, we just explain here in the subject. Next, the brief coping. Brief coping. This one we already discussed. It's developed by Mr. Farber. Actually, this scale consists of 28 statements across two scales and is more focused on understanding and the frequency which people use different coping strategies, okay, to respond various stressors. Actually, here people, what are the strategies they are applying with it measures that. Next one is ways of coping measure, coping technique. In the first one is state coping measure. Actually, this one is called ways of coping checklist. It's developed by Folkman and Lazarus in 1988. Okay, here 66 items will be there with 8 coping skills and 16 filler items. Okay, actually, it's most focused on the real life stressful situation and respond to the ways of coping strategies. So here it's completely into the sub skills include problem focused coping and visual thinking. See, what is visual thinking? People will think visually, yeah, even the positive, whatever they want, they'll think detachment and seeking social support and focusing on the positive. So yeah, few people they go with the self blame. I am the reason. Suppose somebody got sugar or something diabetic, it's a chronic stage. They'll think that oh, my people, my parents, my family members, they said me many times, but I did not listen. I did not follow. Because of these things I am facing right now. Self blame and positive reprisal and escape avoidance and seeking social support and accepting responsibility, self controlling, distancing, and confrontive coping. Confrontive coping means, see, it's happened because of you. I'm suffering because of you, because you prepared a lot of sweets at home. You always kept too many chocolates. Whenever I am in a not good mood, you used to give me a lot of chocolates. That's the reason I'm behaving like this. So people will think like that. So here we need to see all the things. This scale measures. Okay, that's the reason we said this is completely into the questionnaire and tailor-made questionnaire. So this scale based on the questions based on these coping skills. Okay, coping strategies we'll call it as. Clear? This Cronbach score is also very good and yeah, 0.61. So we can use. Now we are going to discuss about the checklist revised. Actually, in this 42 items is there. The total subscales are 5. First one is completely problem focused. How the people are see, few people they don't focus on the solution. They'll focus on the problem. What's the difference between the solution based and focus based? We need to understand. See, whenever people are focusing on the problem, they'll come up with the too many problems. They will add the problems only. Suppose we'll take an example of Diabetic. Simply nowadays people are using the AI and Google. Okay, diabetic may lead to stroke, diabetic may lead to this. See here, my thing is what diabetic. So here, what are the findings? If the person is hit diabetic, what are the chances? They may get paralysis, they may get blah 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 blah. Too many things will come. So here, when the person is into problem focus, he will look into all these things. He will imbibe all the characteristics. He will think overthinking will start. So he don't even hit his bed with peace of mind. So this is called problem focused. Now let me explain the solution focused. See here, this person never focused on what are the reasons for, he will focus on the reasons for diabetic, and he will completely focus on how to recover, how to get over. So solution based, going for a walk, having peaceful sleep, avoiding sugars, avoiding carbs, okay, sleep and diet on time, not to take stress. This is all comes under social solution focus. So here we need to understand. So this subscale is completely focused on the problem focused. See, suppose if you get high score on this, that means he is doubling the problems. We need to understand. Next, wishful thinking. People, they don't do anything. They will think, oh, it's going to be happen like this, like this. No, it's completely wishful thinking. Third person seeks social support. This is good part. So next, blamed self. Oh, this is for me, all this avoidance, you already know. Okay, actually for this scale, they tested on 425 medical students while developing this score. This combat score is very good, 0.74. So we can use this. And they used even the psychiatric outpatients and medical students. So these are the things. Next, we'll discuss about the tried coping measures. Actually, this one is developed by Mr. Miller Behavior Style Scale. Okay, he developed in 1987. And yeah, it access stable difference in attentional focus during uncontrollable threatening events. Uncontrollable threatening events. That means situation is not in their control. Okay, inattention focus, and the person have an inattention problem. He is unable to focus his attention. So this scale measures this, and this MBBS distinguishes between two possible ways of dealing with threat. What is the first one? Seek out information about the threat. First we need to understand from where we are getting the threat. And see, whenever you are understanding the threat, what we have to do, we need to distract oneself from the threat. Suppose, yeah, someone is having a smoking addiction. He knows that if someone is, he's seeing somebody is to smoke, he will go and smoke. So here, this person needs to understand why he's smoking. So his addiction. So he needs to avoid the group, avoid his friends who are all smokers. See, here what he is doing? Distance and distract. He is avoiding the group. And few people, you see, actually, when we are dealing with addictive patients, we'll see many times, like, okay, even our practice also, they will see, actually, I don't want to drink. My office and my home, the way I reach to home from office is exactly the way of the bar. So I tend to go there. My friends were standing there and they call me. So here, what is the distraction? What is the threat he have? That way is threat. So here, if it is too far also, he needs to, but to distract from the threat, he needs to avoid that road. So this scale monitors the behavior style of the person. So what are the distracts and what are the threatening episodes? See, first one is going that way for a who's a addicted person, substance abuse person. Okay, so here, first threat. To avoid the first episode, he needs to change the way. Second thing, people will call him, the friends. So he needs to say not live at that time. After reaching home, he can. Okay, so he needs to avoid the threatening episodes, and he needs to show the reduction in stress level. Suppose he picked the call after his office hours, the people may reach there. So here he can't say no. I mean, he picked the call. They will say, no, 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 we'll come. You just don't drink. You sit with us. I badly need a company. So all these challenges, whatever the behavior styles, the person is improving to come out of his mental health challenges as a coping mechanism. Here we can see everything. Now, next one is minor scoping inventory. In minor scoping inventory developed by Mr. Cronje in 1993. Actually, here, what it measures coping style when approaching threatening situations. See, it's linking with the first one. In the previous scale, Miller behavior scale, we are going with the threatening situation. But here, approaching threatening situations. Okay, here we will understand the ambiguity and of the person to reduce the things, and even we can understand how to protect the individual from the threatening situation. See, we discussed in the addiction case. So here, threatening situation, what I said, not to pick their friends' calls before that, avoiding the way. So this scale measures these things, cognitive avoidance and managing emotional distress. See, my best friends call me to have some smoke or to drink. So here the person is what he is doing, he is avoiding. So what is the distress he have, emotional distress? I didn't pick my friend call, what he will think or she will think about me. What are the things I have to? So here this coping inventory measures the threatening situations and even the monitoring style and how the person is sensitizing towards the situation. All these dimensions, it will help, and yeah, actually all these are non-defensive coping. Okay. Yeah, but here if the person is unable to, if the person is not successful, yes, the anxiety will be more. So all these things we need to look into our thing. Next one is coping inventory for stressful situations. This one is done by Mr. Parker and Endler and Parkler in 1990. Actually, this one is a dispositional measure of coping style. Actually, here 48 items are there. Okay, in this scale. Okay, here we see the person's 16 items are the subscales. It measures the task-oriented coping and emotional-oriented coping and avoidance-oriented coping. See, task-oriented. What is the task he is doing? We'll take the same example. The person wants to, he got addicted towards the substance use like alcohol. So what is the strategy he's doing? Task, he's avoiding the truth and going away from. What is the emotion? He knows that his friends will call. So he avoids. Once he reaches the home, he wants to talk to them. And what are the avoidance oriented coping here? So here all these things are challenges for him. So he is going with all the stressful events. Say 2 kilometers away. Again, suppose if the thing is in Hyderabad, we need to face the traffic. Yes, and one more thing, we need to galiya dete friends lift nahi kare to. I mean, they also have the emotional challenge. This person missing you, right? In the addiction part. So he'll miss in the company, so he will throw some stones. We need to take care. This is the emotion oriented, avoidance oriented. So here you are avoiding everything, and the person got habituated. So he needs to fight with his body and even with the mind. So these are the challenges. It will discuss in the scale based on the things. Yeah, based on his situation, this scale take care of the result. Next one is coping self-efficacy scale. This one is developed by Mr. Chensi, 2006. It measures on individual confidence in their coping strategies. when it comes to handling challenges and stresses. It's completely individual. See, a self-efficacy. Efficacy, right? So here, what are how the person is handling the challenge, how he is able to cope up. These are the things it measures. It's a direct scale, no need to brief more. And brief resilient coping scale. Actually, this one is prepared by Mr. Sinclair and Wallstein, 2004. Okay, actually, this measures the resilient means ability to cope with the stress in highly adaptive ways. See, resilient meaning itself, it's showing the ability, the individual ability, how the person is dealing. Okay. See, few people, they know their friends, they can explain. Few people, yeah, 2 kilometers, the traffic, yeah, I can deal. It's not a big deal when compared to the addiction. So people will, how the people will deal, it's completely, they depends on their ability to cope with the stress. Okay. It measures that. Next one is proactive coping inventory. This one is developed by Mr. Greenglass and Starsware in 1988. Okay, here in this, we have 7 subscales. What are the 7 subscales? First one is proactive coping. Next, preventive coping. Next, reflective coping. Strategic planning, instrumental support seeking, emotional support seeking, and avoidance coping. All the things it measures. We'll discuss about the coping behavior assessment scale. It's completely an Indian adaptation. Okay, it's developed by Mr. Gaukaran, Jangi, and Dr. Priyam Bada Srivatsov. Okay, it measures 28 items in the scale. Actually, coping behavior. So, scale itself, it's explaining you the behavior assessment. Okay, how the person is behavior. Okay, we can measure this. The next one is self perception of flexible coping stress. Okay, actually, this one measures the relations with emotional adjustments. This one is developed by Miss Melanie Jammer and Chen Bag. Okay, actually here it measures self-perceived ability to cope with the stress in a flexible, non-rigid manner. Next one, avoid evidence-based assessment of coping. Actually, this one developed by Mr. Ronald et al. In it focuses on okay here the stressors and even the people, a number of people have been developed the comparison instrument. Actually, in this, the psychometric lesion scales procure valid and general information about coping behavior. Okay, this is completely evidence-based coping. These are the scale we will measure in this. This is all about your coping styles and coping strategies and coping scales and how can we deal and how to deal with the emotion coping and the problem focused coping strategies. This measures all these things. Clear? Next one, for unit 3, we are going to discuss about the chronic and terminal illness. Okay, what is chronic? Actually, Rosie walked into the counselor's room on the request for the college. See, whenever we are discussing about the chronic means what? The severity is more. Okay. So here in this chapter, we are going to discuss about the self-regulatory model illness, cognitions, and what are the psychosocial factors of illness, and how the management of illness, how the person is manageable to, how he is going to manage the illness. Okay, these are the topics we are going to discuss in this chapter. First one, what is the nature of illness? Actually, WHO, they said a state of complete physical, mental, and social well-being is called illness. Okay, in quest of same answer, 1973 interviewed by 80 French people and they categorized 3 categories. One is health in vacuum, meaning the absence of illness is okay, absence of illness. Second one is the reserve of health, meaning the physical strength and ability to withstand illness. See, this they describe like this, the nature of illness. Okay, the reserve of health, meaning the physical strength and ability. Next one is equilibrium. What is equilibrium? It means realization of an individual strength and ability to balance. See, few people they have the illness and their ability is good. They work upon that based on this. So this is called nature of illness. Okay, here what are the things we can see? Psychological factors and social factors in nature of illness. First is experience sign and symptoms of disease. See, whenever we are talking about this experience, one is the biological, the other one is the psychological. See, suppose if the person got a diabetic, first thing he will worry. And the what are the challenges he have? The biological. So these things will do. It explains in nature of illness. Next, the body use ways and means to communicate that there is something wrong with it. Suppose if the person is suffering with the, he is unable to walk. He has some dysfunction in the leg. So here, the body will communicate while dysfunctioning itself. This is nature of illness. See, suppose simple illness, we get cold. What happens? We'll have a respiratory system. That means we can't breathe properly and we can't follow. We are unable to concentrate because we sneeze many times. These are the biological challenges. And what are the psychological? We feel irritated. Okay, all these things will be there. And we don't get sleep. It disturbs on our concentration focus and all these things will be there. Okay. Next, the person would communicate and confirm that he or she is unwell with those who are close, are incomplete, or denial that they are. Few people, what they will say, they will take the help of the doctor. Okay, they'll say, see, these are the challenges I'm facing. Please try to help me. Few people, what they do, they will go and talk to uh, people, needy people, like who can help them, doctors and all other people. Okay, few people they will explain these are the challenges I am going to face it. Please, will you help me? So these are the challenges people will act. They will react. So if the person is unable to do all these things, yes. Again, we have to see why the person is doing like this. What's happening? Okay. So this is called a nature of illness. And the person seek medical help based on the persistency of the symptoms. See, you can see many people, if they get cold, they'll go walk into a drugstore like medical shop and they will take drugs. Few people, they will call their friend or doctor, hey, I'm suffering with these things. Can you help me? Okay, medical help. Okay, few people, they will see the medical practitioners. See, these are all the natural nature of illness. They'll see these are the symptoms I have. What are the things? Okay. And sometimes the illness affects the relationship. Okay. And sometimes people, they don't address their own illness. Few others will say, see, you're suffering, you're behaving like this, please go and see a doctor. Okay. These are, that is called denial. Okay. Suppose few people, oh, they will get anxiety whenever they're hearing some, what do you call, the issue of the illness, they'll see. And yeah, psychosocial impact. They can bring the change in the physical appearance of the person. Suppose if the person is having the nature of illness is different, paralysis. See here what's happening. Okay, they need to, they can't walk properly. Even people will think, oh, he has done a lot of sin, the karma is working on them. So they have the guilt feeling like, no, I did something wrong, that is the thing I don't want. So here, this is the psychosocial factor. I'm looking ugly. I can't go. I can't walk with the stick. I can't sit in the wheelchair and go there. So all this thing, this is the stigma inside. Okay. Towards that, they will create the anxiety and they will go. They don't go for. Few people anger. Okay. See, why are you guys are irritating me? Why you guys are doing like this with me? I know how to take care of myself. So don't do this. So this is anger, denial. Few people, they will completely deny. Hey, nothing happened to me. You people are overreacting. I don't have this disease. I am good. Cancer patients, first they will be, some people, they'll be in shock. Shock means whenever they are listening that, they'll get into shock. They don't go for denial next. I don't have this disease. You only saying. Okay, all these things will come. Next, patients can react to illness. Next, the social psychofactor is physical appearance of the person. We already discussed. In adverse conditions, people ability to function normally. We discussed already. This point, like if the person is suffering with paralysis, he can't mobilize. He needs some help. So when the person is unable to function normally, again turns into a nature of illness. That is one symbol. Okay. Next, in most cases, the person recovers and tries to regain their normal functioning levels. Yeah, like diabetic, even the paralysis also, they will go with the physiotherapy, they'll use medication and they'll recover and they will go back. Okay, Mr. Lau, 1995, he conducted a study. Okay, and he asked the participant, what does that mean to sickness? Okay, here, few people, what are the dimensions they will say? We'll discuss about that right now. First thing, they said not feeling normal means for them, nature of illness means not feeling normal. I don't feel right. Next, he asked about specific symptoms, physiological or psychological, specific illness, cancer, cold, depression, and consequences of illness. I can't do what I usually do. That means there is a dysfunction in day-to-day schedule. Okay, and consequences of illness. I can't do what I usually do. This is called dysfunction. Timeline. How long the symptoms last. See, how long do I need to suffer? That is also comes under nature of illness. Next, they said the absence of health, not being healthy is illness. Yeah, that is also. So these are the definitions. These are the dimensions. When he conducted the survey, he conducted and he asked the participants in 1995. Okay. Next, we'll discuss about the illness cognition self-regulatory model of illness. First thing, we need to identify whatever the patient is thinking, the cognitive function. Okay, briefing about their illness. It's their own opinion. Okay, here, identity. First, we need to understand, we need to diagnose. Even how we can diagnose based on the symptoms. Am I right? Even mental health issues also, with the suffer is if the person is suffering with unable to focus his daily duties, no sleep, thinking more, overthinking, negative thinking, pessimistic person, unable to participate, lack of sleep, see, missing the feeling lonely, all the symptoms. If the person is saying all the symptoms, we'll say, oh, this person might be, because I'm a mental health professional. So, yeah, I'll say, oh, this person is suffering with depression because it's the symptoms. So, same thing. First, we will identify based on his diagnosis and symptoms based. Okay. The second one is perceived cause of illness. What is the cause of illness? Suppose we take the example of cold. The person is diagnosed. Symptom what will have sneezing and running nose. Okay, here what are the causes? First, psychological. He sat with someone in the office. The other person also have cold. Okay, so virus spreads. These are the biological reasons. Psychosocial. What are the psychosocial? Oh, actually, he is in distress from past many days. That's the reason, yes, his immunity is gone down. So that's the reason. So this is called perceived cause of illness. My cold was caused because I got wet. Few people will say, okay, because I wet. Nowadays it's raining, so I got drenched in the rain, so I become. As the person I'm sitting, I sat 2, 3 hours. We are discussing something with him, so the virus is spreading. So we need to understand perceived cause of illness. Next, timeline. What is the timeline from how long? The term how long? Suppose if the person said, okay, I'm suffering with cold more than 5 days or 1 week or 15 days. This timeline also indicates from nature of the illness, means his illness cognition, how long he is affecting. Next, consequences. What are the consequences? Means negative effect of the illness. Suppose if the person said, I can't mobility, I'm unable to talk to the person, I'm unable to produce the way I used to produce earlier. So here, social contacts are loneliness. Suppose the person is having cold, so he don't want to spread that virus. The cold is also virus, so I'm maintaining the loneliness, isolation. See, I think at the time of Corona, many people got isolated. Actually, many people they got depression and all not because of their disease, because of isolation. Nowadays, yes, people got habituated. You can see after Corona and before Corona, when we are discussing about the mental health or anything, any disease also. I mean, so now it's habituated. Without talking to the next person also, people can survive. So consequences and curability and controllability. So here we need to see the patient how shows beliefs. Okay, how he is planning. What is the recover ideas? So we need to listen from his prospect. Next one is self-regulatory model of illness, cognition, interpretation, understanding the problem, how he is understanding, how he is motivating, and how he is able to solve the issue. See, interpretation, understanding the problem, how he is interpreting the problem. Okay, these are the three stages. First one is interpretation, second one is coping, third one is appraisal. In coping means we already discussing, understanding, and regulate the equilibrium, means regain the equilibrium. Appraisal, amazing the effectiveness of coping strategies. Few people, they will take in charge of the problem and they will work upon that. What are the say? Suppose if the person is suffering with cold, he immediately will go for the taking steam and working upon that, gargle with warm water, and he always try to eat, avoid the cold things and sweets, and he will show that completely his equilibrium will change. Okay, he don't go and talk to the people who are suffering with this thing. He'll avoid AC and he will avoid the pollution. So these are the challenges because of the problem, because of the he's taking the uh, complete what do you call emotional in charge of the problem. Okay, so people will take these are called comes under coping styles only. How the person is addressed and how he is approached and how he is perceiving, how he is reacting to emotionally, and how he is thinking, feeling, sensing the cognition of an individual to address the illness. Now we will discuss about the adverse human stages of illness behavior. Okay, first symptom is experience. Next, assumption of risk sick role. Third one is medical care contact, dependent patient role, and recovery and rehabilitation. See, symptoms experience. What are the person having the symptoms? What is his cognitive effect and emotional response? Okay, physical, how he is thinking. Suppose someone is suffering with headache. What he is thinking? He have the ache, where he is. What is his emotion? He is unable to talk, his physical manifest. So here, is he taking tablet or sleeping or having nice lunch and sleep? Okay, or calming himself, like listening music, or few people they go with the warm baths and he will relax himself. So he will minimize the risk factor, minimize the stress factor. So he sometimes he will listen the other person. So here, first thing, symptom experience. Okay, what is went wrong? Assumption of the sick role, the language, the normal roles. Third one is medical care, taking medicines and all. Depend patient role, dependent, accepting the professional treatment, recovery and rehabilitation. Recovery means taking the tablet and if it is severity is more rest or hospitalization. So here, what are the important aspects of this stage? Three stages, three important there. One is in the stage, the sick individual become a patient. The patient claims to adhere the physical treatment. Third one is we already discussed family and referral to continue with the vital part. So they will take the parents or some of the one of the family members help. Okay, these are the things he will try to implement the things to work upon his challenge. See, it applicable to the same like physiological and even mental health issues also. Suppose if the person is unable to taking care or process these things, then it's called a issue with that. Okay, I think we are done. We'll see the next class. Chalo, bye. Take care.